Hi, my name is Carolyn Strnad, and I'm a Family Resource Coordinator for the Minnesota Organization on Fetal Alcohol Syndrome, MOFAS, and the parent of 3 children with fetal alcohol syndrome. In this video clip, I will be speaking about how to advocate effectively for your child in the school system. Advocacy is about identifying problems and developing strategies to provide solutions. Every time you ask for something to be provided to your child based on his or her needs, you are advocating. Every time you attend an IEP meeting to speak on behalf of your child, you are being an advocate for your child. Becoming a good advocate does not happen overnight. It takes time to learn all the rules, the lingo, and the IEP process. Frustrating and overwhelming are the common things we often hear as we work with families. The good news is that you don't have to go it alone. At MOFAS, our #1 goal is helping families navigate systems to receive the services needed for their child with FASD. There are 2 important things you need to know in order to be a good advocate for your child. First, understanding the diagnosis your child has received. You cannot assume that the individual or individuals working with your child know what FASD is. Be ready to educate them on some of the general specifics of the disorder. One way of offering this information is through a 1-page information sheet that includes general information on the diagnosis and how it impacts your child. An easy way to gather that information is to take it from the report that you received from the diagnostic clinic. When in doubt on how to provide general information on FASD, you can always refer them to the MOFAS website at www.mofas.org. If your child has not yet been diagnosed, but there is suspected prenatal exposure to alcohol, let the team know about your concerns and provide them information on FASD. Developing a successful plan includes everyone being on the same page when it comes to information on the disability. Secondly, we know your child best. You know how this disorder has affected his or her way of learning, speaking, memory, and behavior. Don't be afraid to speak up and share what you know. Oftentimes, we get intimidated by the professionals around the table, thinking that they should have all the answers. Not true. Your input is critical to the success your child will have in school and in the other services he or she receives. Most professionals welcome that input. If you happen to be working with someone whose body language or verbal language is telling you differently, check out the video clip on dispute resolution. Now that we've covered the 2 most important things you need to know in order to be a good advocate for your child, how about some strategies to make them happen? First, let's talk about preparing for that all-important IEP meeting. You should collect last year's IEP, some samples of schoolwork, report cards, and any standardized testing results that you may have. And be sure to bring along that diagnostic report from the FASD clinic if you have one. Other team members bring their paperwork. Why not bring yours? Be sure you know the purpose of the meeting and who will be there. The paperwork you receive with the meeting notice should state the purpose of the meeting. Be sure to invite the people you would like to attend. The school is only required to notify educational staff working for your child and those team members required by law. If your child is involved in other services outside of school, you should consider inviting them to the meeting. If your child is transition age, 14 or older, he or she will be invited to the meeting unless you specifically request as their parent that they not attend. Review the previous IEP prior to the meeting. Take note of any items that you want updates on or want to be included again in this year's plan. These items typically are listed on the Accommodations and Modifications page. Make a list of your questions and/or concerns and bring it to the meeting. Depending on the questions you might have, it may be good to list them in the order of which they fall on the IEP. Be on time. Feel confident in your ability to speak on behalf of your child, and your confidence will show. At the meeting, greet everyone as you come in. Remember, you're part of the team, and you have an important role to provide, so don't be afraid to sit on their side of the table. Share your thoughts and information. If you like something they're doing, tell them. If you don't like something they're doing, offer solutions or suggestions on a different way of approaching the issue that would be more helpful for your child. When you don't understand, ask questions. Many parents find that bringing another person with is helpful. As a mother of 3 children with FAS, I frequently bring a friend along to a meeting with me, especially if I know that the meeting will be a difficult one. After the meeting, I can then process with that person to see if they heard the same thing that I heard. You could even ask this support person to take notes for you during the meeting so that you can focus on the discussion rather than trying to write down what everyone is saying at the meeting so you can remember it all later. At those difficult meetings, it may help to remember that the school staff is doing the best they can. Many times they are just as frustrated over the limitations that special education laws require them to operate under. Always take the IEP home after the meeting to review before signing. Even if you agree with what was said at the meeting, that doesn't mean it was accurately reflected in the document. Check before you sign. In conclusion, remember that you are your child's best advocate. Gather the information you need about your child's rights, your child's diagnosis, and your child's strengths and needs. Then use that information to obtain the services that your child needs. Keep your records organized so that you have what you need when you need it. Review the IEP prior to the meeting. Remember, you're part of the IEP team. Your input is critical to the development of that plan, so speak up, ask questions, and give suggestions or ideas of what to do. Use I statements. Watch your body language, facial expressions, and the tone of your voice. Even if things get heated, keep your cool and be respectful. Remember to pat yourself on the back for a job well done in speaking on behalf of your child's needs. If you feel strongly that your child needs services that were denied, check out the video on dispute resolutions to learn ways to address that. For more information on how to teach your child to be a self-advocate, check out the video on helping my child become a self-advocate. And of course, check out the resource guide and directory on the MoFAS website at www.mofas.org.